everyone, and welcome to Families USA's Health Action webinar for February. We're glad folks are able to join us today and are able to pull yourselves away from the Michael Cohen testimony on Capitol Hill and join us for what will be a discussion about what's going on in the states and state and legislative opportunities that will be occurring in 2019. This is one of our monthly webinars that we're going to be doing through the course of this year, focusing on state work, and so we're glad you're able to join us. Today's presentation is being recorded and will be available and posted online following the presentation. We'll also ask that if you have questions, you will take the time to go ahead and, as soon as you think of them, just type them up, put them in the chat box so that we can see the questions, and then we'll be answering questions after each of the presentations, and then have time at the end of the overall presentation to answer a lot more questions going forward. So the agenda for today, we're having the opening from me, Patrick Willard. I'm the Senior Director of State and National Strategic Partnerships here at Families USA. And then we will be followed by Claire McAndrew, who is our Campaigns Manager here at Families USA, Director of Campaigns and Partnerships here at Families. She will take us through the 2019 State and Legislative Agenda, which is a project that we undertook here at Families to prepare for these 2019 legislative sessions, examining what was going on out in the states and what are some options that states can look at in a variety of areas for legislative activity. So Claire will talk about the Families USA agenda, which you can find on the Families USA website and download it there. Following Claire, we will be talking to Tam Ma, who is with the Office of California Governor Gavin Newsom. We wanted to give you a little bit of a taste of what's going on inside some administrations, and so we've asked Tam to talk about what the Newsom administration is proposing around health care for California in the coming year, and so you can get an inside look into what state governors are thinking about and doing in terms of health care proposals. And in a state like California, there's a lot going on. And then we're going to go to Jessie Mandle with Voices for Utah Children to talk about the health policy proposals in what is a tough political environment. Utah is a state with a majority conservative lawmakers and governor, and so we wanted to give you a sense of how state advocates are working in states where you have to really work hard to get the attention of lawmakers and have to be creative in terms of thinking about ways that you can work with them. Then finally, after each of those presentations, we'll open it up for questions and answers and then close things out. And this should take us about an hour for today's presentation. So thank you again for joining us. And at this point, I'll go ahead and turn it over to Claire McAndrew, our Director of Campaigns and Partnerships at Families USA, to talk about the state and legislative agenda. Claire?
Well, thank you, Patrick, and hello, everyone. Good afternoon. I'm going to be talking a little bit, as you'll see on the next slide, about the opportunities that this year brings for progress in the states. So as the next slide shows, we can see that this year we see some opportunities to really move from a defensive climate. Of course, since 2016, over 2017, over 2018, over even 2019, since the federal administration is in office, that largely views healthcare a little bit differently than we do. They don't entirely share our values of ensuring high quality, affordable coverage and improved health for all quite the same way we do. It's put us in quite a defensive position, not just in our federal work, but often in our state work. So of course we've been in a defensive position. And even in the state level, of course, we've worked often with state actors who also have values that are more aligned with those of the federal administration than our own. But I think each year since the 2016 election, across all states, we've also found more room to move proactive agendas that improve health coverage, equity, and value, while still, of course, fighting those defensive battles. So early this year, Families USA took a look at the issues most ripe for progress in states in 2019, and with that overview, created our 2019 agenda for improving healthcare coverage, equity, and value in their states. And we selected items for inclusion based on the trends we observe in state legislatures, working with all of you, the state advocates across the country. And we also selected items based on the pressing consumer health needs that we hear about through our story bank and through people who just reach out to Families USA. They find our website, they call us up, and they tell us what's going on in their lives related to healthcare. And so we see some really strong opportunities for improvement this year. So on the next slide, you'll see the cover of that agenda. As Patrick mentioned, you can find that on our website, and we will pass it out via email after the webinar. But I'm just going to take some time to share some of the top lines from that agenda that we think really provide opportunity in 2019. And so during the Q&A, in addition to any questions, we also really welcome your comments on what you're seeing as really ripe for opportunity in your state or in your organization. And of course, we won't share everything in the agenda, so please do take a look at it after the webinar. So the first item that I'm going to discuss is related to improving private insurance. I won't talk about everything in the agenda, but just some of the top lines. If we can go on to the next slide, you will see that one of the top lines that we're seeing across the country is what to do about junk insurance, of course, perpetuated by the Trump administration, short-term plans, and association health plans. Last year, we saw some states, such as California, Maryland, DC, and others, take a stand and say that even though the Trump administration is saying that these plans could be expanded, they could be extended to run for longer periods of time in the instance of short-term plans, states are putting in law that these plans should either be prohibited or restricted. On the other hand, something to watch out for is that some states already had restrictions in place, for example, restricting plans to 6 months if they're short-term plans. But in states that might not share our values entirely in their leadership, we are seeing states actually follow the Trump administration and put out bills this year that say that short-term plans, for example, should be extended. So that's something to watch for and advocate around. I also want to mention reinsurance, of course, an option that allows lowering premiums at the baseline premium to help distribute the cost of higher cost individuals. A lot of states are interested in this. It's pretty administratively simple. It also allows some easy partnership with the federal government, so it can be quite appealing. We've been doing some work here to help states think through, is this the best option for lowering premiums? Might states also want to look at state-funded subsidies, the next option you'll see on the slide. That's a way at targeting assistance at lower income populations. And so we're doing some work, and we have recently published a paper on this, and we'll have some other papers coming that I'll show you on the next slide. And then the final thing I want to mention, of course, is the trend of exploring Medicaid buy-in and public options. We, of course, are seeing that in New Mexico. Connecticut is exploring a public option. And there's all different ways that states are looking at this. Is it through the Medicaid program? Is it through a state employee plan? And so on the next slide, you'll see 2 examples of resources that we will send after the call. On the next slide, you'll see that one is the 7 state options to reduce the number of the uninsured. And there we go through a dialogue about increasing state subsidies. How would you finance that? And then also the Reinsurance 101 piece is the piece I mentioned that goes through considerations about when is reinsurance your best option versus when might you want to consider funding state-funded subsidies to enhance assistance for low and moderate income people who are those most likely to have trouble affording coverage, even with federal subsidies. So moving on to the next slide, of course, Medicaid expansion and addressing other ways to protect Medicaid at the state level is a key issue this year, as it is in so many years. And I want to acknowledge my colleagues, including Patrick, as well as Elliot Fishman and Sophia Tripoli and others that you've hopefully met with before at Families, because they have established our Medicaid expansion leadership team, through which they're really focused on making the most of opportunities to expand Medicaid, whether it's through taking full advantage to implement the Medicaid ballot initiatives that passed last year in states like Idaho and Nebraska. And of course, Jessie will tell us a little bit about what's going on in Utah. But also there's new opportunities for expansion in states like Kansas and North Carolina. And so I urge you to visit the section of our website called MELT, where you'll see all sorts of toolkits, whether it's trying to figure out how to generate the state share of the cost of expansion, or other issues related to that process. I also want to acknowledge California that last year passed a bill that would prohibit waivers relating to work requirements. It's an interesting option to consider if you want to get ahead of any bad waivers, how you can legislate against that. And so on the next slide, you'll see the issue of oral health. And states have a lot they can explore here to expand this really critical benefit that too often is left out of comprehensive health coverage. And states like Illinois and Massachusetts have established a comprehensive health benefit for dental health benefit in Medicaid. And then some other states are taking an incremental approach to get there, whether it's just covering preventive services, just covering key populations, like pregnant people or people who have disabilities. And so again, Patrick Willard on the line is a key expert in this, also Melissa Burrows, but it's a really important opportunity for states to explore, included in our agenda. I also then want to move on to an area that's really fertile ground, expanding coverage for immigrants. And you'll see on this slide that the data really speak to why this is so important. Immigrants, and especially undocumented immigrants, are much, much more likely to be uninsured, whether in the child population or the adult population, than people who are citizens. And already 6 states cover all kids regardless of immigration status, and more states are working towards this year. There's a significant campaign in New Jersey on the issue of covering all kids, and Jessie's going to tell us about a campaign in Utah, and Tam's going to tell us about a campaign focused beyond children to covering young adults. And so we're seeing this issue pop up in more states as a viable campaign issue, and I think that's really exciting. On the next slide, you'll see information about a really key issue at Families USA, which is our issue to advance equity through system transformation. It's such a big priority at Families USA that we have an entire center on it. Hopefully you've learned a little bit about this already from Cincy Hernandez-Cancio, the center's director. And there is a priority agenda. That's the image you see on the right. The National Priority Agenda has a whole host of policies in it that can be pursued at the federal level, but also at the state level. And these include things like, for example, getting the right data you need to even figure out how improvements are working. So data that has to be disaggregated to capture disparities and measure progress, something that California has really been a national leader on, getting even into, making sure you have data by specific Asian Pacific Islander groups, legislation that passed in 2016. There's also great legislation that states can pass around community health workers, something Connecticut's been a leader on. So there's so much to explore, and I'd encourage you really checking out that publication. And so moving on to prescription drug prices, this is an issue that's near and dear to my heart. I could spend hours talking about it, but I won't right now. But what I will say is this is really taking off like wildfire in legislatures. I'm actually sitting in an Illinois legislator's office right now because we just did a hearing and a press conference on this in the state of Illinois. I'm sitting next to Justin Mendoza, a key leader at Families on this issue. But these are some of the policies that are popular in states, and they're listed on the slide in order of the most robust policies down to the policies that are a little bit of a less direct approach. So the policies of anti-price gouging, basically fining companies for high increases, setting up an affordability board, which is a policy in Maryland, to say, the state is going to pay, no more than this price if you're a private insurer or a public insurer in the state. This is what we think the fair price is for this drug, making the process more transparent for why manufacturers are charging a certain rate, or regulating pharmacy benefit managers. All of these get into the drug supply system and make it more accountable and ultimately make drugs fairer. And this is just bipartisan. If you're not working on it already and want to, please do reach out to us. We think it has real potential. The next trend that we're seeing in state legislatures is addressing surprise out-of-network bills. I think this is something a lot of folks across the country have worked on, and we know it has a lot of bipartisan potential. The federal government is working on it. There's real potential there, but of course we wouldn't urge states to wait for federal action because states, of course, need to keep the momentum going in case there's any stalling at the federal level. But even if the federal government does take action, states can fine-tune what they think is the best option for them. And I've shown some examples of what we think are models at the state level: New Jersey, New York, California, Florida, because it's an example of a state that's not thought of as the most progressive place, but it does have a good model. And then a report from the Commonwealth Fund that just shows what's happened across the country as a resource. And so finally, I just want to acknowledge the issue of driving value in healthcare. We have to make sure that the system is accountable for delivering cost-effective care that is high quality. And California, our partners at Health Access, passed a bill last year, of course, with the legislature, but they were real supporting leaders, to actually take a look at mergers of health insurers and figure out, are these mergers actually creating efficiencies and driving higher quality, or are they just driving up costs? And so I showed an image of the fact sheet on this bill from Health Access. It's a place where states really can play a role, and I'd urge folks to take a look at it. So the takeaways overall, I know this was on many topics, but it was really meant to show that even in this tough climate, the tough federal climate, often a tough state climate, there are creative options for proactive innovation. There are a wide range of topics that we're seeing across the country, states making process that we can all explore to drive progress on health coverage, health equity, and value, and we are really here to help. We're working with folks all over the country. We're tracking where the progress is, and we want to spread that progress everywhere, in every state. So please do reach out to us. We want to strategize on policy and on how to get those policies across the finish line. So thank you so much, and we're here to take questions and to provide assistance. So thank you.
Thank you, Claire. Again, if people have questions, please type your questions in the chat box, and we'll be able to answer those questions. We don't have any right now, but we can answer them at the end of the overall presentations. I know we've given you a lot of categories to think about and a lot of bills to think about. These are issues and ideas that have come up from many state leaders across the country, and many of these ideas were discussed during our Health Action Conference, which we held last month, attracting around 600 state advocates across the country. And so there you would have heard about many of these ideas in workshops and in plenaries and presentations that are going on. This document here, our agenda for improving healthcare coverage, equity, and value in the states, really sort of gives you a quick way to dive into some of these ideas and think about options that are out there for you. We recognize, of course, that many legislatures are well into their sessions right now, and that these are things that you might want to be thinking about for the future. But there's also opportunities to think about how you might tweak or amend or do work on current legislation right now, taking these ideas from our legislative agenda. So take a look at it and start thinking about how it fits in with what you're facing in your legislature right now. At this point, we're going to give you a chance to hear from inside the state capitol, from someone who is actually part of an administration. So our next speaker will be Tam Ma, who is the Deputy Legislative Secretary for the Office of California Governor Gavin Newsom. And she is going to take us through some of the health care proposals that the Newsom administration has laid out here at the beginning of this legislative session. So Tam, I'll turn it over to you.
Great. Well, thank you so much, and good. I guess for those West Coasters, good morning, and for the East Coasters, good afternoon. Again, my name is Tam Ma, and I'm Governor Newsom's Deputy Legislative Secretary, and I am his point person on all legislation related to health and human services. And so my job is to advance the governor's legislative agenda on these issues, and also manage the relationship with the legislators and all of the bills and things that they are proposing this session. And so I'm very excited to join you all this morning and share about what we are doing here in the governor's office and the proposals that he's put forth with regards to health care. The governor believes that the California dream should be accessible to everyone and not just a privileged few. And so his health care proposals are a central pillar of his broader California for All agenda. And he's very committed to finding bold and innovative solutions to confront the cost and affordability crisis that families are facing across the state, whether it's related to housing and transportation, childcare, and and very much healthcare as well. and we could go to the first slide, please. So California embraced the Affordable Care Act, which has allowed us to reduce our uninsured rate by more than half. And as the federal government takes steps backwards on health care, California is moving forward to protect and build upon our coverage gains here. Governor Newsom is proposing to reinstate the individual mandate penalty at the state level to maintain stability in the health insurance market and make coverage more affordable and accessible. Since the removal of the federal mandate penalty, California has already seen a decrease of almost 25% among new enrollees in our Covered California, which is our health benefit exchange. And we know that our uninsured rate will increase if we don't act to reinstate the penalty. We propose to use the revenues generated from the penalty to fund state subsidies for low and middle income families. And the proposal would be to provide additional subsidies for people who currently get subsidies, those between 250 and 400% of the federal poverty line. And then we also want to create new subsidies for those that face the cliff now, those between 400 and 600% of federal poverty level who don't get any financial assistance. And these subsidies are important in a high-cost state like California, where healthcare generally is more expensive, but also housing, transportation, childcare, and other costs eat up a significant portion of a family's budget. And we are developing the details of this proposal at this point, and I will say that the mandate penalty will be modeled after the federal mandate, mainly for ease of administration and compliance, since there's already a set of rules out there that folks know, and like all the different federal guidance related to the penalty and exemptions and things. So it's easier for people to comply with it and easier for us to administer it. It's modeling after something that's already existing. And then the governor also proposes to extend Medi-Cal or Medicaid coverage to undocumented young people ages 19 to 25, reaffirming his commitment to health care as a human right. This would bring an additional 138,000 people into comprehensive coverage in California. Undocumented adults right now comprise about half of our remaining uninsured, and they have access to coverage for emergency services only. 2 years ago, we expanded coverage to all income-eligible kids regardless of immigration status, and we've enrolled over 200,000 kids, and we'd like to build on this success by extending coverage to young adults. And this proposal is consistent with the Affordable Care Act's requirement that allows young adults to stay on their parents' insurance through age 26, and we believe this is another step towards covering all Californians. Next slide, please. The governor has also appointed Dr. Nadine Burke Harris as California's first ever Surgeon General. She will lead our efforts in addressing the root causes of serious health conditions, such as adverse childhood experiences and the social determinants of health. The overwhelming scientific consensus is that there are early signals and causes of many serious health conditions, and the Surgeon General will marshal the insights and energy of medical professionals, public health experts, public servants, and everyday Californians to address health inequity as early as possible in all of our lives. And Dr. Burke Harris has a fabulous TED Talk about how childhood trauma affects health across a lifetime, and I encourage you to check it out, and I've included a link in the slide here. Next slide, please. And the governor, in addition to the proposals relating to creating a individual mandate and penalty at the state level and providing state subsidies, the governor's budget also invests in prevention to improve health outcomes and reduce healthcare costs. We also hope to improve health by reducing poverty and invest in mental health workforce, increasing provider reimbursement rates in a Medicaid program, and improving service delivery. Next slide. So in addition to expanding coverage and making it more affordable and focusing on prevention, we're also taking on cost containment, starting with prescription drugs. And this is a key part of addressing the affordability challenge and making sure that California can afford to get to universal coverage. California passed a price transparency law back in 2017 that requires drug companies to give advance notice of big price hikes. Pharma has challenged the law in court, and we are continuing to defend this law and while working to implement it. Governor Newsom's first act in office was to sign an executive order that directs state agencies to work together to lower the price of high-cost drugs through joint purchasing and to identify opportunities for the private sector to add to our purchasing clout. This would be bringing together, right now the state, purchases drugs, on behalf of state employees, of, our veterans programs, state hospitals, corrections, colleges, universities, and there's also like local government, everything. And so we really do need to, take advantage of our market power and pull all of our, purchasing power together to drive down costs. The governor's executive order also directs our State Department of Healthcare Services, which runs our Medicaid program, to increase our purchasing clout within the Medicaid program from 2 million people to 13 million people that are in the program by ending the Medicaid managed care carve-out for pharmacy benefit services. So, we, think this is very important to look at, the cost drivers in healthcare, starting with prescription drugs, and we also have our eye on hospital and provider consolidation as well. So stay tuned for that. Next slide, please. And then the last thing that I'd want to share with folks is, our ideas for a federal innovation waiver. So the Affordable Care Act has provided us with a strong foundation to build on, and we are working to expand coverage, increase the subsidies, invest in prevention, and do bulk purchasing of prescription drugs. And these are all the things that we can do as a state that doesn't require any kind of federal, approval or partnership. But Governor Newsom does want to pursue other transformative changes to allow us to achieve universal coverage, contain costs, and promote quality and affordability. And so, unfortunately, current federal law only allows for limited piecemeal innovation and not the comprehensive reform necessary to address the myriad challenges that we have in our healthcare system. So on his first day in office, the governor also sent a letter to the White House and to congressional leaders calling on the federal government to lift these limitations and empower states like California to begin reforms that provide the path to a single-payer healthcare system. So this pretty much sums up our healthcare agenda coming out of the governor's office this year. It's a very broad, dynamic agenda, and I'm very excited to be a part of his team and work on bringing all these ideas into fruition. We are at the beginning of our legislative session, and the legislature has introduced 2,600 pieces of legislation. A big chunk of those address healthcare, and so we're also looking forward to working with our legislature and our advocacy community here in California on other ideas to continue moving us forward, getting more people covered, containing healthcare costs, and improving quality and equity.
Great. Thanks so much, Tam. And again, if folks have questions, please feel free to type questions in the chat box, and we'll get to those questions at the end. I do have one question here, Tam, for you. The individual mandate and the impact of the individual mandate. Has there been sort of a determination about how putting the individual mandate back will be able to, how many people that will end up affecting, and how it will be able to ensure that you're keeping the uninsured down and the quality of the insurance up in California?
So we're doing the modeling to kind of understand, how many folks have paid the mandate penalty in the past, and unfortunately, there's a little bit of a data lag there and everything. So we're doing the modeling to see, kind of how many folks, we would be able to keep in coverage who otherwise would drop coverage, and how much, revenue would be raised, and how that money would be allocated towards subsidies.
Right.
But what we do know, and particularly from Covered California, our state exchange, based on the data on open enrollment this year, was that they did see a 25% drop in new enrollees compared to the prior year. And there are a number of reasons why there might be a drop in new enrollees, but when you kind of factor in all those things, they do believe that a big chunk of that is because of the lack of the federal penalty.
Right. One of the things that obviously we've heard from some states is that the individual mandate was the most unpopular part of the Affordable Care Act, and so there has been some resistance to putting in an individual mandate in some states. Do you feel confident that that can happen in California, and is there general understanding of the value there?
Right. Yeah. No, we think that there's good understanding of the value, and partly is that we're not just reinstating the mandate penalty, but we're proposing to also provide state-level subsidies to either supplement the federal subsidies or create subsidies for the first time for folks that are higher up in the income scale. So it's we're proposing to take the revenue and invest in making coverage more affordable so that it is easier for people to sign up and keep their coverage.
Right. Thanks so much.
And the governor sees those two things as inextricably linked. So it's the two parts of the proposal.
Got it. Okay. Well, thank you. So we'll move on now to the next presentation, which is Jessie Mandle from Utah Voices for Children. She's the Senior Health Policy Analyst there, and I saw Jessie as recently as at the conference, and then prior to that when I was out in Salt Lake City for some of the conversations there around the ballot initiative and other healthcare topics that were going on in Utah. So Jessie, I'll turn it over to you.
Great. Thank you so much. Yes, thanks again. It's great to be on this webinar. I'm with Voices for Utah Children, and we're a multi-issue advocacy organization. We work on issues statewide. I work on our health issues, but we also have an amazing staff that works on issues around early childhood and juvenile justice, tax and budget. So just to kind of give an overview of what we work on, and we are actually in the midst of our legislative session currently, so it's definitely a hectic and crazy time. But I wanted to, oops, did that move forward? I wanted to just kind of give a quick overview of what we're working on both in the long term and the short term. Full disclosure, there will probably be a lot of pictures of Utah. I'm a relatively new Utah transplant and still blown away by the state, so there's a lot of scenic Utah pictures in my slides. But I just wanted to talk a little bit about, Claire mentioned we have a campaign, a long-term 100% kids coverage campaign, and then I'll take a step back and talk about some of our 2019 legislative work, including around access and quality and private insurance protections, and also some of the work that we're even doing to move the conversation upstream and address the social determinants of health and health equity. But first, because this is Utah. This is a positive webinar, so I'm not going to really rehash the tussle over Medicaid expansion that we've had in this state. Recently, for many of you on the phone, you will know that our legislature did roll back the voter-approved Medicaid expansion that passed in November, and they replaced it with a more expensive plan that covers fewer people and puts up some significant barriers and risks and restrictions to care. So we will be engaged in opposing the waivers that Utah proposed at the federal level. We'll be doing a lot of work here. But since this is a positive webinar, I want to think about some of the silver lining of this Medicaid expansion debate that we've had here, and maybe some of the opportunities it presents. And thinking about that, I would say we have a public and we have legislators that are more engaged in issues around health care coverage, affordability, and access than we've had in years. And so we're really in some ways a really exciting place. This Medicaid expansion, the ballot initiative, and the recent legislative rollback has been a game changer, but it's really changed our healthcare landscape, and I think it's going to help. I think it could help propel and highlight some of the other policies in areas that affect people's coverage and care. And so that's some silver lining as we move forward. And I think we will, in the long term, see, especially with so many of our new legislators, them engaged in new ways on these issues. And one of those ways that, in particular, I think this will help for years to come potentially is the 100% Kids Coverage campaign that we're going to be launching this spring. We've had so many new legislators, as the Medicaid expansion debate played out, we've had so many new legislators ask, why do we have such a high uninsured rate in Utah for children, especially because they said, well, kids should get coverage under Medicaid CHIP. And so that's been a really great way for us to start talking about what coverage for kids really looks like in Utah. And as you can see here, we have a significant number of uninsured kids in the state, and actually that 6% is now just bumped up to 7%. We are one of the states that saw an increase in our child uninsured rate between 2016 and 2017. And so that is one of the reasons why we're going to be launching a campaign to cover all children regardless of citizenship status here in Utah. And we're really excited to join other states like New Jersey, like Pennsylvania that are working on this. But we think there's some real opportunities in a red state, even in this sort of tough political climate that we face. Utah's a very child-friendly state. We have one of the highest rates, if not the highest rate of children as percentage of the total population. We like babies and kids here. We have big families. And we're also, there's a real unique culture here that's very welcoming to refugees, to immigrants, and so I think that does sort of change the context in which we're having some of the conversations here. But Utah does have the highest rate of uninsured Latino children in the U.S. and one of the highest rates of uninsured kids overall. So we know there's a lot that we need to be doing, and there's a lot of kids that are left out. And we think one of the reasons that the child uninsured rate in Utah continues to grow is because, as we see nationally, that climate of fear. And so this campaign that we're launching is one of the biggest ways that we think we can begin to counter that climate of fear and shift the culture in Utah so that we have a culture where people really expect and demand that all children have coverage. And I think we have legislators that are increasingly receptive to this idea, to recognizing that the kids are being left out. And so to kind of give you an umbrella of what this 100% Kids campaign looks like, we're going to be building both long and short-term strategies. So we're going to be working on strategies to keep kids covered all year round and reduce churn, and I'll be talking about that in just a minute. We're going to be talking about outreach and enrollment, because we know that families, regardless of status, are having trouble enrolling and getting connected with coverage. And we'll be defending and protecting Medicaid. And I should say, too, that a few years back, Utah did pass legislation to remove the 5-year waiting period for lawfully present kids, but we do still see occasional threats to even roll back that. So we do need to continually keep our eye on the ball for protecting and defending Medicaid. And then in a few years, we hope to run some legislation to cover all kids regardless of immigration status, so that they can get Medicaid or CHIP coverage. And of course, that's not happening this year. Right now, we're just trying to engage with partners. We're working with community partners statewide. We've engaged in a lot of exciting story collection, really just kind of building the momentum and building that coalition of partners to start shifting the culture, start changing the conversation around how we think about kids. When we say all kids, we really mean all kids. And so this is a multi-year campaign, but it's been really exciting and really positive, especially against some of the tough climate that we've been facing recently. This is sort of a way that we, I think, can be a little bit more proactive, and it doesn't have to feel like we're constantly just on the defense. So as I mentioned, part of our 100% Kids campaign is also addressing some smaller solutions for 2019, including this issue of churn and helping kids not only enroll but also stay covered. And this idea of churn or continuous eligibility is something we've been working on for a really long time. This session, we have been addressing it through smaller ways, such as intent language that can help address make it easier for kids to complete their reviews, because that's an area where we do see a lot of kids fall off. And we're continuing to work on a policy of 12-month continuous eligibility or 12-month continuous coverage in Medicaid, which we don't have. So that means that kids can easily fall off if a parent gets a slight change or bump in their income. And we see that happen all the time. And this has also been a way for us to really try and get a handle around the messaging of administrative red tape and complexity. And this has actually kind of dovetails into the work that we sometimes do around work reporting requirements, because we can say, look, we know that whenever you increase the administrative complexity of a program or increase the red tape, then kids and families fall off. And that's something that does seem to resonate with some of our legislators. So these are policies that we think will have an impact in the short term and also for our larger campaign to cover all kids. But as we think about the 100% campaign, it's also really important that we talk about access to care, especially in Medicaid and CHIP, because we hear from so many families that they feel frustrated. Like they get Medicaid, but it's hard to get care. It's hard to get dental care. It's hard to access care in schools. And so that's why we continue kind of work on this access piece in tandem with coverage. And again, we're working on smaller ways, and this can be through appropriations request instead of running a big bill. Sometimes that's an easier way to get things through in our legislative environment. And also attaching language to other bills. That's something that we've also been working on. So in the oral health realm, we're trying to monitor Medicaid. We are in a dental managed care system now. So trying to monitor that and also make it easier for kids to get dental care in schools. And then we've also been trying to work on leveraging Medicaid dollars in schools. So just a shout out to the Healthy Schools campaign. We've been trying to reverse that free care rule in Medicaid and so that we can draw down more federal dollars for school-based care. And then we also worked on an appropriations request to improve maternal and early childhood screening and care. So that, and we worked with a coalition of partners on this. And this was got a lot of great attention from our legislators to talk about how we can think about parents and kids together. We did that in expansion, but now this is another way to start thinking about the care in early childhood. Thinking about the care the parents get is important, and not just thinking about kids in kind of isolation or a vacuum, which is sometimes easy to do, especially I think in a red state environment. And then post-session, of course, we'll be involved in monitoring, engage with our departments and agencies, and not just to keep harping this, but I think in a red state, sometimes the most effective way to get things through can really be outside of the session through rulemaking, through working with departments and agencies as they implement bills. We also have been getting great traction around private insurance and consumer protections, and working with a lot of great organizations here like the Utah Health Policy Project and Action Utah that are leading out on bills to address some of the cost and prescription drug costs and price transparency. We are still expecting a bill around surprise billing to come out this session. We've been working for a long time on that here in Utah, and do think there will be a bill this session, hopefully, knock on wood. And there's even some innovative things that some of our legislators and partners have been proposing, like importing drugs from Canada. That actually got some national press too. And that's been a really great way to build connections with lawmakers to, and not just beyond Medicaid expansion, talking about affordability, talking about consumer protections in ways that I think have really resonated with them. So that's been a good way to work with lawmakers up here. And also I should just add that rulemaking continues to be an important way that we will engage with lawmakers, and we'll be doing a lot of that outside of this session. And then finally, as we move forward, thinking about our 100% Kids campaign, and also thinking about access and care more broadly and health equity, we do want to continue to move upstream to address those social determinants of health. So Utah, too, is looking at different ways to expand peer support networks, like in our maternal mental health appropriations. Actually, we've talked a lot about how we can expand peer support and access for community health workers. And there's some really interesting conversations happening around social determinants of health here in our bad Medicaid expansion rollback. Still bad, but there was a piece of that legislation that talked about leveraging Medicaid dollars to improve housing services and housing affordability, especially for those experiencing homelessness. And while we'll continually be opposing those waivers, it really does provide a nice opportunity to start talking about how can we leverage dollars and Medicaid to address the social determinants of health. Same with transportation and interpretation services. We do a lot of work on protecting EPSDT, and going forward I think we'll want to be doing more to look at how EPSDT services can be leveraged so that more families and kids are able to get to appointments, use transportation, and get translation and interpretation services in healthcare environments. So that's just a very quick overview about some of the work we're doing to not just improve coverage, but also care, especially for kids and families in a red state that's a little bruised and a little dented, but I think we'll be stronger as a result. So thanks so much, Patrick.
Sure, thanks, Jessie. And I do think it's worth sort of understanding where things are in Utah in terms of Medicaid. And so correct me if I'm wrong here, that beginning April 1st, people who have not been able to get Medicaid will be able to begin enrolling. All those people that are up to 100% of the federal poverty level will begin to start enrolling in Medicaid in Utah.
Yeah.
Is that correct? So this
That's
is
correct. That's what we expect to happen. It's not in code, so there still needs to be federal approval for that to happen. But we do expect, and we're hearing from agencies that we're on track for that. So April 1st, those between 0 and 100% should start enrolling. Of course, later that coverage will be subject to some additional barriers, like a work reporting requirement, but that won't begin April 1st. So on April 1st, we will have people who previously were not eligible should be eligible to start enrolling in Medicaid coverage.
Right, and so more people will be receiving coverage under the Medicaid in Utah. And the waivers that have been submitted and were submitted previously have not been approved by CMS at this time. And so we don't know if we don't know the status of those waivers, and we'll have to wait and see if they're approved or not. What we do know is that initially this will be a regular match, which in Utah is a 70-30 match, not the 90-10 match that that expansion states get. And so that is so the state's putting up more money, but they are covering those people up to 100%. So those are, to my mind, positive steps that are being taken in Utah. And then obviously with your campaign for 100% coverage for kids, are you expecting to reach some of those goals this year? Is this a long-term campaign? How does that play out?
So it's a long-term campaign, but it's sort of under that campaign we kind of have umbrella policies. So we do want to address like 12-month continuous eligibility to help reduce churn. That's one way that we think can help kids, we can reach 100% because we know that so much of coverage is not just about enrolling but also retention. And like you said, the outreach and enrollment piece that we will see from beginning April 1st, that's a way that we also want to make sure that people get covered, and that will be a way to bring in families that previously were not eligible. And then we'll be working towards legislation that would help kids, regardless of immigration status, to enroll. But that won't be this year, or likely won't be next. So that it is a multi-year campaign, but with kind of these umbrella steps to not just cover kids regardless of status under Medicaid and SHIP, but also make sure that we are smoothing out our eligibility and enrollment and outreach so that we address some of those bumps that keep kids from getting covered as well.
Great, thanks. So again, if folks have questions, please be sure to type them in and into the chat box, and we'll ask those questions. I do have one that's for Claire McAndrew regarding the agenda itself, and in particular the fact that you said you were in Illinois working on prescription drug legislation. Could you give us a little sense of how the interest is developing around prescription drugs, and what it is that states can be doing in this area, and what are they interested in doing in Illinois?
Sure. So the interest in prescription drugs at the state level initially, I think, started with a thought that there's not that much states can do. This is really something that the federal government has authority over. And so initially, states were looking primarily at transparency. How can we shed light on what drugs cost, how much they're increasing, and why they cost so much? So we saw some really important bills passed in states like California and Oregon to make information that wasn't otherwise available more transparent, with the idea that this would put more accountability to lower drug prices. But now states are saying that's not enough. We actually want to go farther. We want to get at the direct problem and try to actually lower increases. And so some of the bills that are taking a more aggressive approach include creating affordability boards. That's a bill that Maryland is pushing and getting pretty far with because they introduced it last year, and now this year hoping to actually pass it. And that's one of the bills that we're here in Illinois working on. The other is a bill to get at price gouging. So the drug that's already been around has already launched, and then year after year, the price goes up and up and up outrageously. And so that second bill around gouging, Maryland introduced a bill in it. It got caught up in the courts. So this is a new way to get that same issue. It's actually a proposal that was designed by Pew that would essentially fine companies if they increase prices over a set threshold. The bill in Illinois says that if any amount that's increasing over inflation for certain drugs, the drug company would be fined on those amounts in a way that doesn't get passed on back to the consumer. So here in Illinois, they've created a whole new committee around prescription drugs, access and affordability. My colleague Justin here did a presentation today in that committee, and then we did a press conference to introduce this package of bills. And so they're interested in all sorts of things. Those two bills I mentioned, but they're also interested in regulating PBMs and doing transparency, working on detailing so that it's not just the drug companies going into doctors' offices trying to sell them every new drug. They actually want to get more academics involved in that process so the information is fair. So really, we could do a whole, and we actually have done a whole webinar on all the things that states can do because there's a lot they can do, and we're encouraging them not to just wait for the federal government, but to go ahead and take direct action.
Great. Thanks, Claire. A question for Tam Ma regarding the governor's proposal and what's going on in California. One of the things that you mentioned as part of the trying to make subsidies available for folks was that they would start at the 250% of the federal poverty level. What about those folks below the 250% level? Is that something that you guys have thought about, or is there a feeling that is taken care of both by Medicaid and the subsidies that folks are currently getting?
Yeah. So the governor's proposal, the governor proposes to provide state subsidies for people, between 250 and 400% of federal poverty level to, provide additional subsidies layered above what the federal subsidies are right now, and then to create new subsidies for folks, between 400 and 600%. And so that's what's been proposed, and understand that there are, there's going to be conversations throughout the budget process and negotiations with the legislature on what, that looks like. And I know there's interest in, not only, covering more people, across the income scale, but also, the size of the subsidies and everything. So that's all, subject to conversation. Yeah.
Got it. So those are the sort of starting points in the legislative process, but there's obviously the legislative process itself to go through, and the back and forth that would be part of that process between the administration and the legislature.
Yes.
Great. Okay. One question we had for Jessie. One of the things you mentioned, Jessie, was in the post-session period in terms of addressing Medicaid, that there would be some looking at contracts and how contracts might be used in terms of increasing access to the Medicaid program in Utah. How can these contracts be used?
Oh, yeah. Well, one way, for example, is dental contracts. So I mentioned that Utah is moving to our whole state will be, for kids, will be managed care dental contracts. So we've been and actually got some great suggestions from colleagues in California around language that could be in those contracts. For example, around data that should be collected, or how they're monitoring those networks, or at least propose to, or any benchmarks that plans need to meet. So things like that we have been working with our Department of Health on as they go out to bid. So that was one area. So those are ways that we've been trying to work with our Medicaid department on those contracts.
And so even though there has been, obviously, you're in a red state and you've gone through this sort of fight with some of the more conservative legislators and the conservative majority, you're still able to work with the administrations and with the Medicaid department on different ideas around contracts or other issues.
Yeah, and also, thank you, Patrick, for the reminder that people will be getting some coverage on April 1st, and to kind of that positive reminder and some of everything that just happened. But we are still able to work with our department, and I would say it's especially important because we have a really stretched department. Medicaid is constantly under the microscope of our legislature to cut dollars, and so they don't have a lot of staff. And so ways that we can help say, this is where we're hearing that people aren't able to access care, or, and to just bring up dental again, can we do, calls or any kind of, mystery shoppers, things like that we can try to flag. Look, this is where we're hearing that people are not getting care, because a lot of times on the dental side, what we'll see is that people might say they accept Medicaid, but then they only see like one patient a year, but they're listed in the overall resource guidance. So things that we can do to flag any issues like that, I think, are welcome by our department, because I think they have a limited capacity really to monitor some of these issues. Not because of interest, but because of capacity and staffing.
Right, but I think it's a great point that even in these red states, there's the ability to work and find ways to be creative, to make some improvements and find ways to improve access by bringing out ideas that departments are interested in and being of help to departments. And I think it's important for us to understand that even in the tough situations, we have the ability to do this work. Another question for Tam Ma. What about Californians on the individual market without subsidies who are not wealthy, say a family of 4 with a silver plan that would cost around $30,000 a year? Is that one of those things that will be addressed during the legislative process, Tam, or one of the things you guys will be focusing on?
Can you repeat the question? Sorry. Yeah,
the question was, what about Californians on the individual market without subsidies? Say $160,000 is not, so someone who might be making $160,000, or a family of 4 with a silver PPO that would cost about $30,000 plus deductibles. So I think it's some of those people that we saw that were in this sort of the area below 250% of the federal poverty level, that sort of group. And those are the folks you're talking about would be where you're working with the legislature. Is that right?
Sure. Yeah. No. I mean, we are doing the modeling to see kind of where the how the subsidies would be allocated and everything. The governor's proposal does focus on folks who are between 250 and 600% of the federal poverty level. So I know there's like different details and stuff like that. So we're going to be rolling that out in the coming months and everything. But again, with everything, this is his budget proposal, and it's subject to negotiations and conversations with the legislature.
And I know those things change from one branch to the other, and so there's a lot of that goes along. Well, great. Well, I want to thank all of our presenters on today's webinar. Thank you, Tam Ma, from Deputy Legislative Secretary with the Office of California Governor Gavin Newsom. And thank you, Jessie Mandle, from the Utah Voices for Children. And thank you to Claire McAndrew, who is our Director of Campaigns and Partnerships here at Families USA. We appreciate everyone joining us today. There will be a survey that will pop up following this webinar presentation, and we would ask you to please fill it out. We're going to be doing these surveys doing these webinars every month, and by filling out the survey, you can give us ideas for topics that you would like for us to address in a webinar. So fill out that webinar, that survey. Our next webinar will be on March 20th, and at the same time. So we'll be sending you information about the topic for that webinar, and look forward to having you join us at that time. But thank you again, and everyone have a great day.